good day, everyone. Hope you are doing fine. Welcome to another episode of the Express channel. And today we're going to be talking about how healthcare assistants can relocate to the UK. I'm really so happy doing this video. I'm so happy because I feel and I know that I'll be responding to so many requests being made by my subscribers, our followers. We've actually done like a seminar before on our Telegram channel on how one can relocate to the UK. That initial time when it was really hot, like when it just came out, that's when we did the seminar. But I believe some people might not have watched it or been there, so they've been requesting and requesting and requesting, and so today we've decided to talk about this. So we're going to be talking about what the step-by-step process is, how to search for jobs. We're going to talk about how to prepare for your interview. We're going to talk about just everything in general, like everything about relocating to the UK as a healthcare assistant. Okay, if you're meeting us for the first time, like we always say, click that subscribe button now, just so whenever we upload videos like this, you'll be among the first ones to see it and watch it and be able to use the information given to you. And also, if you like the video, kindly please click that thumbs up just to encourage us to do more videos like this. Don't forget to also hit the notification bell so that when you're sleeping and you upload videos, you say, oh, another new update, and then you quickly take advantage of it. Okay, and if you're a returning subscriber, we want to say thank you so much. Thank you for staying with us, and God really bless you for being with us. Thank you very much, and let's get started. So welcome back to our channel. I just want to let you know that I've written down what we're going to talk about, okay, on my notes. Yeah, so whenever I look down, just know that I'm trying to get so I won't misplace. You know, at times when we talk we can just miss our point, so just so we'll be probably directed. Okay, so first we're going to talk about who is an healthcare assistant. Okay, it's not just healthcare assistant pathway health. Who is actually this healthcare assistant we're talking about? Okay, and healthcare assistants, they're people or individuals that work in different settings. It could be the care home settings, they could work as domiciliary healthcare assistant, they could work as live-in carers, so they also work in the hospitals as well. So they actually work in to assist in rendering healthcare services to people that actually need it. So most of the time they support healthcare workers such as the nurses. Most of the time nurses, they support them in rendering cares. So what roles do they do? They act in different, their job descriptions include things like helping in hygienic needs, it includes things like helping in rehabilitation, offering psychological care to patients, especially the disabled ones or those that are actually one way and other not opportune to be able to do or carry on these activities by themselves. So they actually help in rendering hands and all that, and really they are so brilliant. I've met so many wonderful healthcare assistants. You'll be so amazed at how much they know and how much they do. Okay, so to all the healthcare assistants, I want to say thank you and I love you all. Thank you for all you do, and you are much appreciated. Okay, so now we've covered who the healthcare assistant is, we're going to talk about what are the stages in relocating to the UK as an healthcare assistant. Okay, so first, the first thing you need to do is gathering your documents. You need to gather your documents that you need to that you will need for the whole process. So it's not just I want to relocate. You need to get your documents. Number one on the list is your passport. My sister, my brother, if you don't have a passport by this time and you are thinking of relocating, abeg hey, please. So the first thing to do is to get your passport. You need to start the process of getting internship, as this is one of the requirements. I also need to have your birth certificate. Mind you, you need to ensure that, let's say you have a passport now and you have also a birth certificate, and date of birth doesn't tally. Both of them needs to tally. So if you have something like that, you need to be thinking about swearing and affidavits now, just to cover up for that. In regards to the passport, let's say you're one that travel to different places and your passport paper, it's almost filled up. Please, you need to get another one, or you need to renew it, because you need a passport that has spaces for them to stamp on when you've gotten your visa. So next, you're also going to need, let's say your passport is going to expire in the next 5 to 6 months, because you don't know when you are going to get this job or how long your process is going to take. That means you need to think about renewing that passport now, just so that you won't start hurrying or panicking, let's say when it gets the time that your passport is going to expire. So please try to renew your passport. Okay, so next, let's say you're going to be stating that probably in your CV, probably you've done any qualification, like probably you're a nurse, you want to say you're a nurse or something, you've done a qualification, probably you're a social worker, so you also ensure that you have that your school certificate. Or let's say you are from a country that actually train healthcare workers, you guys have a course that you do, so you need to get that document, that certificate, that you'll be able to use or show your employer whenever they need proof of whenever they ask for proof of your documents. So you will need that. Fourth on my list that you're going to be needing is you're going to be needing an IELTS, or will I say an English requirement. The good thing about it is that you just need a band score of 4, which is very, I think anybody can get that. It's 4, so you're going to be needing an IELTS. And then the next question people will ask me, which IELTS? Please, the IELTS you will need for the healthcare pathway is the UKVI. Okay, so we're going to be doing another video to talk about the various type of IELTS, so that you won't take the wrong one, because if you take the wrong one, you might have to go back and write the right one, and it's really not funny having to spend so much money to take the other one and going to write another one. It can be really devastating. So please do not forget, you need to take the UKVI. We have the academics and the general, but we're going to talk about this in another video. But the UKVI, either the academics or the general, either of them is the one you will need to, if you want to follow the healthcare assistant pathway. Okay, let's say you don't want to write IELTS. What is the substitute? You can use your OET, and OET can stand for you in this healthcare assistant pathway. Okay, and OET, you can use that. If you don't want to use the IELTS, you don't want to use the OET, and you are a graduate, let's say you have a BSc upward, a BSc, a master's degree, a PhD, you can use the NABIC proof of English. That's what it was previously called. So you can use NABIC proof of English. So what you need to do is you need to apply to any.org.uk. So after you've applied to any.org.uk, you upload your transcript, upload all your documents, and then you can be able to get a statement of a proof. It's called a proof of English, a statement to state that you were actually taught in English, and then that can stand for your visa process. Phase 2. So the phase 2 now, so all the phase 1 and the phase 2 and even the phase 3 is still more like a preparatory phase anyway. So the next phase, what you're going to be doing is you need to, let's say you're someone that is not that's not worked in the healthcare setting before, or don't really know what it is to work as an healthcare assistant or volunteer anywhere. You understand, or you don't really know anything of what an healthcare is. So now is the time to probably volunteer in an hospital, volunteer in a care home, volunteer in even a crèche, taking care of babies, places that can give you a reference. You understand? But they kind of have preference for healthcare people that can give you a reference. Let's say you've gotten the job, so it's time for you to volunteer in these places. And let's just say you're volunteering for a period of 3 months, just to whenever you are, let's volunteer there. At least it should be a place that can also reference you, don't forget, and then get that experience. Let's say you also observe that maybe they are doing a voluntary thing. Let's say they are doing like at times in some countries they do like this outreach, healthcare outreach, that kind of thing. You can also volunteer to understand what it is to work in this form of setting. So now is the time to do that. Let's say also you because at times you don't really need a care certificate. But what we have been hearing these days is that most because the competition has gotten really tough, and most people now, it's hard to get this job. I'm not going to sugarcoat anything. I'm not going to say just go online and apply just like that. You go. No, I'm not going to sugarcoat anything. It's not that easy anymore, because first, everyone knows about the process, and everyone knows you don't need to even have a background healthcare training to be able to get. So everyone now wants to go through the healthcare assistant pathway. So now they started requiring for you to do some courses. Okay, I'm going to be dropping some links in the description of places you can go to get those courses online, and most of the time these courses needed to be done can be done online. Okay, so you need, from what I've heard from other people that have gotten the job, they call it the 15 care certificate or 15 care courses. I'm also going to be dropping that. I'm also going to be dropping that for you to go ahead and just go through it and probably get those courses so that you'll be able to at least be qualified like others. You understand? So just do these online courses, and I believe you'll be good to go. So volunteer and get some experience and get the care certificate, and that is the end of phase 2. Now, what's phase 3? Phase 3 is you need to prepare your CV. In this stage, I'm going to try as much as possible to talk about it lengthy, but I promise to do a video on CV preparation alone. Like, we're going to go and break it down, we're going to show you the step by step, so you can just with that video be able to create the best CV ever that can take you out of, or take you to get the job that you want to get. Okay, so let's talk about this CV now. How do you prepare your CV? Because this is one of the most important parts when trying to apply for jobs, because there's going to be so many CVs coming through. You're going to get people from Ghana, Nigeria, Australia, Canada, US, the Philippines, the Indians, we have the Pakistans, we have people from different countries coming in. How do we make ourselves stand out? Do you understand? So this is what we're going to be talking about when we do that CV video. Okay, so how do we make ourselves stand out? So we're talking about ensuring that your CV is tailored towards the job specification. Now you'll be asking yourself, oh, am I going to wait now till I see a job opening before I prepare my CV? No, like I said, this is a preparatory phase. What can you do? You can go to website like indeed.com, go to carehome.uk, carehome.co.uk, go to website, go to LinkedIn. You will see care jobs available. Even Glassdoor, go there, you see care job available. Even Trade jobs, go there, and then when you see these care jobs, you just check them, look at their job description, try to create a CV that carries such thing. Now we're just doing a preparation phase now. It's not like we've seen a job opening yet. We are doing a preparation phase. So just prepare your CV just like that, so that whenever you've seen a job opening and you want to apply with your CV, all you just need to do is to adjust your CV a little bit to their own specific job description. Do you understand? And so that's what I'm talking about. So you need to go there, see what the care job is all about. But if you have actually done phase 2, like going to volunteer, you at least know what the healthcare job is, and you'll be able to tailor your CV in the right way, because this is what you have done, and you are not actually lying or fabricating something wrong. Do you understand? So these are one of the ways you can prepare your CV. Another thing is, when preparing your CV, things like putting your age there, your nationality, country you are from, country you are born, putting your picture, all those things are really not important. Actually, we always advise to avoid putting it. In as much as we say that some things are not existing, but we still know that just to ensure a more fair ground, you understand, it's better they don't even know you physically or even know what you look like. Let them look at your qualification and let your qualification define you. There's no need of you putting you are married. Nobody cares. Whether you are married, whether you are single, whether you are young, whether you are old, no one cares. So to ensure that nobody really cares, you understand, it's best you don't put them. What they are only interested is your name, maybe your name, your phone number, your address, and your email. All those other things are not important, so try to take them out in your CV. So ensure that also whenever you're doing your CV, oh, see, I'm already talking about CV. Don't worry, we're going to talk about that in another video, okay? Because it means that I won't be able to cover everything that we have to talk about. So anyway, let me still drop the last tip. Ensure that when you are creating your CV, you should be creating your CV in a way that you're not just putting the general words like I'm confident, I'm obedient, I'm punctual. Like, everybody is punctual. That is true. Everybody is obedient, everybody is punctual. So you should be putting things like, let's say the training in giving in safeguarding, you understand, and then you've also cared for these people in this type of setting. You are being specific and talking about what you do. I'm not saying you should not also put in that you are punctual, but ensure that those skills you are talking about are mentioned a bit lesser than these other skills I've spoken on. Okay, so don't worry, just stay tuned for that video. We're going to talk more on it. All right, yeah. So you should also have a good cover letter. Now this cover letter is just going to talk about, it's like a summary of what your CV is all about. So attaching a cover letter also helps, especially whereby you there are so many people that they need to look out for their CV and whatever. So a cover letter that is very catching can really make them glued to your CV. Do you understand? So these are ways to ensure that you have a good be selected for an interview. All right, okay. So now what's the next step? So now it's time to apply for jobs. You can try websites like carehome.co.uk. You can try Indeed. You can try LinkedIn. You can try Facebook. You can even check on YouTube, because at times some of us YouTubers, we drop actually updates whenever some care homes are actually opening. So you can also check that. Join Telegram groups as well too that talk about international journey, talk about relocation, talk about care home jobs. You understand? So these are ways you can actually get jobs, and there are so many jobs out there. But that doesn't mean there are so many jobs out there. It means that they are actually giving visa to those that are coming from international places. So when you are applying for these jobs, you should be focusing on jobs that can offer you tier 2 sponsorship or skilled worker visa. That's the job. That's the kind of job you'll be looking for. Those that can offer you what are they called? They can offer you COS or can sponsor your visa. I'm also going to be dropping the link in the description of qualified employers or approved employers or sponsors by the UK. So you can always search for this job, and if you see it, you can go and verify on the UK government website if these companies are actually eligible for rendering you this sponsorship. I actually think many now these days are actually eligible to rent that sponsorship, but it's just to go and cross check. Okay, so you start to apply. I always say you should try to apply to at least 15 to 20 every day. So people be like, what? Yes, even nurses that people are always saying the common nurses job, it's not easy again this day. So even people have to go ahead and apply to 15 to 20 days. When I was coming to the UK, that is about 2 years back now, I had to apply 10 to 15 jobs every day for 1 month before I could even get one job. And trust you, when you start getting that first job, it's like other job begins to come along. You understand? I don't know what principle it works on, but that's just one of it. So don't be discouraged. I know it's not easy. Just try. Okay, don't give up. So dear, now you've applied for up to 15 to 20 jobs, let's say every day, using these different websites which I've initially mentioned. So you've applied and you finally gotten like an invite for an interview. How do you get prepared for this interview? Like I said, we've done a video, but I'm still going to talk a bit on it. So how do we prepare for this interview? Before that day, you need to ensure that you've gone through YouTube videos, you've gone online to research on what healthcare job is all about, and you've gone through the job specification and job description. So it depends on where you're applying for. So like I said before, we've gotten what are they calling this? We've got there are different type of healthcare assistant job. We have the domiciliary healthcare assistant job. So those ones you have to have like a driver's license. So this is where I forgot to mention this initially as part of the document. So it's also important that if you are applying for a domiciliary healthcare worker job, you need to have an international driver's license. Why is that? Because if you have an international driver's license, when you come to the UK, you can use that driver's license for 1 year. Then within that 1 year you are driving with your international license, you need to try and get the UK driver's license, and then you can continue to use it. Okay, so after this interview now, probably you've passed the interview, and they've given you the job, and they've given you a job contract to sign. This stage, please, if you are wearing glasses and probably your glasses is having issue, try to clean it well, and put on the best of glasses and read your contract word for word. Okay, ensure that it is something you can do. It's not you will come to the UK now and then you'll be like, I want to die. Oh no, it's not like. Most of the time the type of job carers does is like a 12-hour straight job in the UK. You understand? So maybe they will tell you that your contract says you're going to be working in the UK for, let's say, 40 hours a week, or 44 hours a week, or 39 hours a week. So you will sit down and look at it. 11 hours or 12 hours a day, it means that you'll be working like 4 days. You understand? Stretch. Do you get what I'm saying? In a week. So when you really look at it, you ask yourself, is it what you can do? Is it what your body can carry you to do? If it's not, please don't bother to sign that paper, because signing it is like a legal documentation that you've actually accepted to do this job, and it can be held against you. So ensure you are reading it word for word. Now, for those people that probably are nurses or doctors or health physiotherapists or health radiographers and want to come to work as healthcare assistant, maybe your initial plan is just to work for 6 months, please read that line well. If it says that if they give you a contract of 3 years or 5 years, and then they tell you that if you leave them before that time you have to pay 10,000, how will you raise 10,000 pounds within 3 years? Or not, let's say not within 2 years, sorry. How will you raise 10,000 pounds within 6 months? Like you say you want to leave them, you know that one is not possible, so that job is not for you. So you need to read all those lines very well to be sure of what you are actually signing up for. It's not when you come and you say you want to leave them, you will pay that 10,000 pounds. So you need to be very careful when you are reading or signing your employment contract. Okay, it's very, very important, and so that you will be safe. Okay, we all need to be safe. We're looking out for ourselves. All right. Yeah, so next, now after you've signed the contract, probably they will tell you it's time to do employment checks. Yeah, so you're going to be needing references. Most of the time the reference you might be needing, it's going to be professional references. So what are professional references? Most of the time these company references, or people that work for company, so they might give them a specific professional email that's actually for their job. So most of them, that's what most company needs, or most care home will request for you to have. So I believe you should sort that out on how to get those references. That's what we always say initially. If you're volunteering, you should volunteer in places that can give you references, and they can always reach out to them and they can give a response back to them that you've actually worked there and you are who you say you are. Okay, then at this point, although some people in some country like Nigeria now, your police report or your police clearance lasts for 3 years, for 3 months. So most people want to do their police report when they might actually really need it, which is at the visa phase. But at times some places will want, some care homes or some employers will want to see a police report or a police clearance, just to be sure that you're a safe person. So you might have to do that one. So you will need a police clearance just for your these are part of your employment checklist. Okay, and then also you might also need to answer some health related questions. Please don't hide anything. So there's this law that talks about this Equality Act in UK. So even if you are having one disability or something, just be honest, just state it there during the employment checks and fill up all the health questionnaires. Nobody is going to send you away for having one this thing or another, because that means they are being discriminatory to you, and there is a law against that in the UK. And UK is really a law abiding state that you must always obey by the law. So back to the interview preparation. So you need to actually read and prepare for this interview based on the role you're going to be playing. Let's say when you've been given that job. So if you're applying for a living care home, so you need to be searching for job interviews on that has been done by other people on living carers. If you're checking for care home jobs, you need to be checking on interviews that have actually been done by people who are working in a care home job. If you're doing for domiciliary, you need to check on those type of interviews. So depending on what your work is going to be, you need to search for interviews on that. Then also you need to also research on the company you're going to be working with. If you get the job, you need to check their goals, you need to check their trust values, you understand? So these are how you prepare for your interview. And on the day of that interview, you need to ensure that where you're going to be doing the interview, most of the time people do the interview online, so either through Microsoft Word, Microsoft, through Excel, through Google Meet. These are several ways in which the hospital actually do interview, or care home does interview online. So you need to have all those apps. Anyway, they're going to let you know before that day that you need to download those apps in preparation for those interview. You need to ensure that you have good network. All right, so let's say you are in a place whereby the network is not good. My sister and brother, please go to a site that has, let's say it's your church that have good network. Ensure that day you have dressed up and you have gone to church that day to have that interview. Like, take it like it's once in a lifetime opportunity, because this is what people are looking for. All right, so let's say now you've ensured that you have good network. Now, please still ensure that the area you are has good lighting. It needs to have good lighting. It needs to be quiet. It's not the place that someone is shouting, come and buy pure water, or come and buy something, or there are children outside making noise, or there's someone, probably your neighbor is playing a loud music. So if it's possible for you to request for your neighbor to, or your family members, brothers, sisters, to ensure that that room or wherever you're going to be having that interview, your children, is actually quiet that day. Try your possible best to ensure that such thing is done. Okay, now always ensure that when you're doing the interview, you're seeing your interviewer as a friend, because that in a way helps you to calm down. And just calm down, you've got it. Speak slowly, try to don't be too fast, just try to be calm and try to highlight your qualities when talking. Okay, don't just beat around the bush. Ensure that you are highlighting your qualities, highlighting what they are looking for, highlighting their job, the job specification they are looking for. Ensure that you've highlighted it in regards to your own role and what you've done before. Also, make sure that you've read your CV. Very important, because on that day of interview, some interviewers are going to be holding your CV to be sure that what you said is what you're saying is equally to what you've given to them. It's not you say you've worked in Sokoto, then the next time they ask you, you are not telling what is written down on your CV is, oh, I'm currently working in another place. How does that correlate? So please ensure that you are saying the truth. I'm begging you, please, it's very important you are saying the truth, and what you've documented is corresponding to what you are saying on the day of your interview. All right, so now you've passed the whole stage, you've gotten the job, and now congratulations for waiting for your certificate of sponsorship. So remember, I said that when you are applying for your job, you should always ensure that it's the job that can give you certificate of sponsorship, because you are going to need that to get your visa. So now you're going to be waiting for your certificate of sponsorship. At times it can take 4 weeks to 8 months to get your certificate of sponsorship. It's just like, it's actually a number, you understand, but it's going to be given to you in a paper or in a PDF format. So it's that certificate of sponsorship you will use now and go to apply for your visa. You cannot apply for your visa without that. And at times, if you're, it's also going to talk about state your certificate of sponsorship, how many years you are having a contract with your employer, and also how many years you might have to how many years you're having contract with your employer, and then what your job role is. So it's all stated there in your certificate of sponsorship. So you are going to be needing that to apply for your visa. Another thing you need to also look out for during the visa phase, or during this time you need to apply for a visa, is if your or if the hospital or the care home is going to be sponsoring your visa, then your CS is going to state it. Then you don't need to you don't need to be so concerned about having to ensure that you have money in your account, because sometimes they will tell you that they might not sponsor some things, you get. So it means that you need to have a proof of funds in your account of at least £1,270 equivalent in your own currency. So just to be on the safer side, we always encourage people that just ensure that you should have that amount of money at least for 1 month in your account, or even almost 2 months. So you need to have that money. They need to see that money coming in. At least they will know that this person can actually cater for themselves right there in the UK. It's very important, because it's not when you finally pass the visa now they will not say that is what is holding you back, and that's going to prevent you from getting your visa. Nobody wants that. So just to be on the safer side, just have that proof of fund. So if they decide now to finally state on the COS that they are going to sponsor you while you come into the UK and care for you, stated on the COS, just for stating sake, you know you are covered. But if it's not stated, that means you are still covered, because you've actually done the right thing by ensuring that that money is still in your account. Do you understand? So for your visa, you might be needing a TB test. So at that stage, you need to be going ahead to do your TB test after you've gotten your certificate of sponsorship. Now, don't forget, please, at this stage, hope you have not put in your resignation letter. It's very important not to put in your resignation letter yet. Just hold that resignation. Just don't put it in yet, because it's a visa stage. Anything can happen within that period. So just calm down. Still keep working in your current employment. Okay? Yeah. So you're going to need your TB certificates, and you're going to be needing your IELTS or your OET or your NAMIC. So this is when you are submitting all this. You're going to be submitting your police clearance as well, okay? And then you're going to be submitting, let's say, your employment letter. They might request for it. So these are what you're going to be submitting, or and any other document. They will actually send you a message that you need to send all these documents, or they're actually there on the website for you to ensure that you're submitting the right document. So you've submitted your document now and you're waiting for a visa. Visa normally takes 3 to 4 weeks to come in. So let's say you've gotten your visa now. Congrats! So now means you're like 1 step in and 1 step out of the UK. So that's what it means at this stage. You're almost finished. Yeah, congratulations, my brother or my sister. Congratulations. So you finally gotten your visa now. At this stage, you can go ahead and give those people, say, take your resignation letter. I'm not working with you anymore. So you can go ahead and do that now. So you can put in your resignation letter, and then after putting your resignation letter, you can now apply for your flights. Okay, you can apply for your flights, tickets, and then we always advise, please, we always advise to come in alone first. You know you are coming to a strange land. You're coming to a strange land. You don't know the laws, you don't know the rules, you don't know how it is. So it's not where you want to bring in your family and everybody just like that. The culture shock and the shock you're going to receive might be too massive. You understand? So at this stage, you always advise to come in first. Probably you settle for, like, let's say, a month. And then the truth is, to even get a house for the first time in UK, even for people that are in the UK, is hard. So it's not that easy. It's not like you just go ahead, walk around and just see house to rent. It's not like that. It's not that easy. You need so many references, so many checks, and you don't have a history before in the UK. So it's going to take a lot before you can get a house. So you need to be settled first, okay? So you need to settle, let's say, for a month, and within that period, you are in the UK. You can be you can apply for what's the name? apply for houses. And don't forget, when you've arrived in the UK, there's still some couple of things you need to do. We're also going to do a video on these things, the things you must do when you arrive in the UK. Things like you need to go and book with your GP, you need to have a bank account, you see. So these are things you also need to do when you get into the UK. And then the website you need to go to look for houses, and so that you can at least, you know what, we've covered you, all your location, all your things you need to know, you are covered by knowing us. All right, so like we've said before, coming to the UK, okay, coming to the UK, settle down a bit, and then you can bring in your family. Okay, yeah, so that's what we always say. So now, let's say you finally gotten the job, you've arrived in the UK. What next do you have to do after arriving in the UK? I'm going to drop our email address. You can send us a message just to say we've arrived. It's just so that we can celebrate with you and tell you congratulations, you know, probably give you some guidance. You know, you're in a strange country land, you understand? They just give you some guidance and everything, but congratulations. I will be so happy at least to know that someone really benefited from the video, and to also encourage us to do more, to help more people. Do you understand? So thank you guys for watching and staying with us throughout this video. Thank you. We really appreciate all your love. We really appreciate everything you've done for us. And please, if you know you've learned so much from this video, we really took our time to do so many of our videos, so please encourage us by clicking that thumbs up, yeah, and don't forget to subscribe and also click that notification bell. We've also done several videos, you see. We've done so many on nurses pathway, we've done on teachers pathway and other professions. Don't worry, you're not left out. We're going to be talking about this in details. Even soon you will get so many people coming in to give you more information too on all this process, and so that your hope and your dream of traveling out and working in different countries is going to be achieved. So don't worry, we've got your back. Okay, so thank you again, and we'll see you on our next video. Bye.